All right, so we're gonna start talking about this amazing topic for me. I'm Tatiana Chavarriaga. I will be here with you in the next 20 minutes. I'm a physical therapist expert. I'm the COO founder at EVI, where we empower women to take control of their pelvic floor symptoms. I have spent over 5 years learning about digital health, about tele-rehab and women's health. And because of that, we also have been recognized by the MIT as innovators under 35 in Latin America. So we're going to dive into the women's health and we're going to understand why it deserves some special attention, right? This is not just about health, it's also about breaking down barriers inside companies and also the corporate world. So please take your coffee and sit very comfortable. Let's have an honest conversation about why women need different health benefits. So I want you to imagine this situation. Imagine that you are in a typical workday. You have deadlines, you have meetings, you have a lot of responsibilities, of course. But now we're going to add that you are dealing with pelvic floor dysfunction. So this may include symptoms such as pelvic pain, bathroom discomfort, urinary incontinence, and many other challenges that we can suffer as a woman. So this is a reality for many of women at this moment, and this can be very emotional and physically tough for them. So have you ever asked yourself, like, how can we make the workplaces more anatomy with vaginas, for example, and some individuals that are dealing also with pelvic health issues. So first, we need to learn that pelvic health has a different wide range of conditions and concerns. Some of them are very exclusively affecting women. Others can impact worse in women. And some of them also, they manifest very different in women. So I'm going to talk about these categories a little bit so you can understand why is this important. So let's talk about the conditions that exclusively affect women. First, we have a pregnancy and childbirth, right? So of course, these are unique process experiences that only women can experience. And during pregnancy, our bodies suffer like a big and huge change, that our uterus is growing and we need to carry on this baby for the next 9 months. And of course, it can also put a lot of pressure in our pelvic floor muscles, and our abdominal muscles as well. And this can lead to issues such as lower back pain, urinary incontinence, and abdominal weakness. On the other side, we have another condition that is exclusively to women. It's the pelvic organ prolapse. So if you don't know what is this, it sounds very complicated, but it's when the organs like the bladder, the uterus, or the rectum, they might descend into our vagina, and this can result from weakness into our pelvic tissue or muscles. For example, there are studies that they suggest that pelvic organ prolapse can affect approximately 50% of women who have given birth. So it's actually really a huge number, right? On the other side, we have the conditions that are predominantly affecting women. We have endometriosis. This is one of the most common conditions, and it's when the tissue that we have it's growing outside the uterus, and it can include symptoms such as chronic pelvic pain, pain during menstruation, during intercourse, or also fertility issues. So this can affect around 10% of reproductive age women and can be highly debilitating. So I want to let you see like how big is this problem. For example, on average, it takes around 7 to 8 years for women to receive a diagnosis of endometriosis. And most of them, they have been like needing more than 10 appointments before being referred to a specialist, because lack of knowledge. That's the problem. And another condition that it's impacting women is polycystic ovary syndrome, or PCOS. So statistics shows that it affects between 5% and 10% of women of reproductive age. So this is an hormonal disorder that mainly affects women, and it's characterized by because we have like an enlarged ovaries with a small cyst or a small cyst, and they can cause issues like irregular menstrual cycles, weight pain, insulin resistance, and difficulty by conceiving. And last but not least, we have the conditions that manifest differently in women. The most typical or the most prominent example, it can be heart attacks. Like when women are experiencing like a heart attack, it's very different the symptoms that men are experiencing. We have more jaw pain, extreme fatigue, or nauseous. So it can be very difficult to detect these conditions in our bodies because they believe that it's the same in women and men. So as a healthcare professional, we all need to know the difference and to be very informed about these sensitive topics and the difference to provide the best possible care to our patients, right? So of course, these conditions, that the three conditions that we have been talking, they impact the women's productivity. They impact our daily life, our quality life. So pelvic floor dysfunctions, like the ones that I have mentioned before, such as pelvic pain, sexual discomfort, incontinence, they can significantly impact women's daily work lives. These conditions can cause distraction, discomfort, physical limitation, of course, and it will lead us to affect our productivity. So we have two main topics, like how these conditions can affect our physical well-being and also our emotional and mental well-being. So in the first place, this can decrease, for example, mobility. So we avoid to do exercise, to do some sports, and also limitate our daily activities, making super challenging to stay focused at work or to make the tasks, and also decreasing efficiency. And for example, sexual discomfort. We cannot relate this with work, right? But you can imagine that you have some sexual pain. And this can lead, for example, to stress and also avoiding to have sexual intimacy with your partner. So this can negatively affect overall our satisfaction in the daily basis. We have urinary incontinence that also is very common in women that in our age, like we don't talk about it, we suffer in silence, and this can result very embarrassment because you don't want to lose pee when you're working or when you are in the office. And also this can decrease our self-esteem and limit our physical activities because we don't want to have these mistakes or errors, right? And on the emotional mental well-being, they also impact very hard to us. Like pelvic disorders can cause emotional stress, anxiety, depression, and we may experience frustration, irritability, mood swings due to this chronic pain, or impact our sexual and reproductive life, of course. So this is a reality, and it's very important that we talk about this topic inside companies, because living with pelvic disorders can significantly affect women's quality of life and well-being. That's why it's very important for us to start promoting inclusiveness by recognizing that pelvic health problems can affect too many women in our teams, in our workplaces, and just we need to give some benefits to our members and employees so they can feel that we care about them, that they deserve the support, and at every stage of their lives, such as giving benefits for pregnancy preparation, postpartum recoveries, for example, and how to come back to work after having a baby, during menopause. That this can be really hard topics or really hard moments for a woman. Sexual health, pelvic pain, and bladder conditions. So how can we help, like through the things that we are doing? For example, I just want to let you this example, like it's not very difficult for you to help the women of your team. So we in EV are giving like some different programs for every woman that it may have like a chronic condition or a pelvic floor dysfunction, and maybe they don't know. So we offer like pelvic health specialists for them. Like you will have access to a one-to-one session with a physical therapist expert in women's health, and also we can give you the follow-up sessions in the all program in order to help you recover from this, right? And through the app, we give you like some exercise that you can follow every day in so many places. Like it's not just to make the exercise at home, but also when you're in the office, or when you're working, or when you're in the way to the commute, and so on. So you have different options to treat your pain and to don't suffer alone, and have the guidance of a professional also, that it's teaching you how to treat your pain. So as I say, it's very important for us to start educating women about these conditions, educate people about why is this important inside companies, and also give them like some videos, audio, articles through the app, like so you can understand a little more your body. And also, if you know your body, if you are very educated, you can search for help when you are having these concerns, on you will know what is normal and what is not normal, right? So what are the benefits for the companies or the workplaces to bring this kind of services? Like first, women, we all know that we have the different needs, right? So having access to appropriate services and treatments, we are promoting equity in the work environment. So this can create a supportive and inclusive environment where women feel value, when we feel seen, and also empowered to address our pelvic health conditions. So it's not a taboo anymore. So we don't have to deal with these conditions alone in silence, because it's very embarrassment that some people know. So no, you have just to search for the right help, and you also and your team can also understand that it's very normal, and but not needs to be very that it's very common, but it doesn't need to be normal in our bodies. Also, this can lead to improve the productivity of your female team. So when women have access to adequate healthcare, it will improve our health and our productivity, both at work and in their personal lives. And investing in women's health initiatives can contribute to overall to help in the culture of wellness, promoting employee engagement, satisfaction, and of course, retention. So by preventing and treating illness in an early stage, companies can save in healthcare costs, and also in treatments that can be in treatments that also can avoid some symptoms and some illness after. In addition, you also can reduce indirectly the costs, such as lost work days, absenteeism, and so on. So we all understand that women and men have different needs. And when it comes to health, of course, and access to resources, we need to tackle these issues. And we use gender equity strategies to work toward this equality in the workplace. I just want to read this text that I found in the website of the World Health Organization, and it's about empowerment. So when we are talking about empowerment, it means that we are taking charge of our own life, right? So that's the meaning. But it's having the ability to make choices and also act on them. So it's in our hands, it's in our power to make and start talking about these topics inside our companies. So empowerment is both a process and it's also a goal. So women's empowerment, as in the website say, is like, it's incredibly important for us for achieving gender equality, but it's worth noting that women empower themselves. So we don't have no one else that can do it, but institutions and corporate work and society as a whole can provide crucial support along this journey. So this empowerment is in our hands. It's in our decision to take action to start talking about the topic. And now, when we are talking about diversity, equality, and in the framework of the companies, it's about recognizing that women and men are totally different. We have different anatomy, we have different needs, and divided in terms of age, wealth, education, culture, sexual orientation, disabilities. For example, we need to address the gender and the health issues, considering these characteristics, this difference, and tailor our to give more approaches or the right approaches to our teams. So yeah, that's the message for today. I want to let you know that you're not alone, that we are here all to talk about this, that I will love to talk to you. I will love to work together towards changing the narrative about women's health inside the workplace. And if you like to connect with me, just you can do it through social media, you can drop me an email. I will let all the details after the event so you can have access to some contacts. We just need to raise our voice, so our voice matters, and we are more inclusive and supportive, creating these environments inside our workplaces. So please just join to this, how do you say that, to this vision, and together we can create a workplace where every woman feels very empowered, valued, seen, and also supported in their pelvic health journey. So basically, this is everything for today. See you in the next month. We will have a webinar actually about how to bridge the gender health gap in the companies. And you can subscribe, you can be there as well if you want. And yeah, I want to create this kind of community or this kind of support. So all that we are fighting into this topic, please let me know, how can I help you? How can I make something for you as well? So if you don't have the information, I want to let you know that we can help you as well, like starting to educating your teams, educating your people, so it's not that difficult for us to raise our voices. So thank you so much for being here. It's a pleasure for me to share about this topic that I really, really, really care. And see you next month.